Health Outreach Mobile Engagement.
We have a very strong belief in providing accessible, barrier-free healthcare to the most marginalized members of our community, and that's what we do every day.
Health Outreach Mobile Engagement, or H.O.M.E, is a collaboration between 5 different partners: the London InterCommunity Health Centre, Middlesex London Paramedic Service, Regional HIV AIDS Connection, and CMHA Addiction and Mental Health Supports of Thames Valley, and also London Care's Homeless Response Services. During 2020, at the beginning of the pandemic, we typically served individuals who had barriers to traditional healthcare. And what we found was during the pandemic, the barriers were increased, if you will. So doors began to close. People didn't have access to the services that they were accustomed to. The community partners who served the population came together and decided to try and take the services they required to them in the community rather than have them have to come to our locations.
The idea of meeting people where they're at, both physically and emotionally, means there's no judgment, bias, or preconceived notions. It's just genuine, holistic care. We've taken exactly what we do in the clinic and added wheels. With this bus, we can see up to 150 people a day.
These individuals are quite marginalized in our community and experience barriers on a daily basis, and having them attend our services in the community and just showing the appreciation for the care and support that they're receiving, both clinical and social supports, has been just fantastic.
This is more than acute care. It's more than treating cuts and scrapes. It's effective, efficient primary care provided to folks who are incredibly marginalized and otherwise just wouldn't have access to that kind of service.
We've literally transformed people's lives, and it's been such a privilege to be a part of. And we've brought them into a welcoming situation. We treat them in a way that we would like to be treated and provide them the care they both need and deserve.
A commitment to providing accessible, barrier-free, non-judgmental care for everyone is a measure of a community as a whole. Real change has to start somewhere. We can't continue to go about our daily lives and witness what we're witnessing without feeling the need to make change.
I have some lived experience in homelessness and substance use and mental health. It's no surprise to me that people cope in various ways, whether it's substance use, whether it's making decisions that aren't necessarily the best for their physical and mental health. It's really no surprise to me. Being able to be there for these folks in the community when the need arises and make it easy for them to access the services they require is just really meaningful to me. This community collaboration knocks down those silos that we all tend to work in, and being collaborative not only with the partners, but asking the folks that we're serving what it is they need and how we can be of service to them is just so meaningful.